Okay, guys, so in this lecture, we're going to look at the maturation of different bone cells, different bone marrow cells, and different blood cells, how the blood cells are formed from the red bone marrow stem cells. Okay, now we have the generalized stem cells that gives rise to almost all the different types of blood components, blood cells which are present in the blood. Okay, they are called the pluripotential hematopoietic stem cells. And okay, now let's get started with their propagation. Okay, a very small proportion of pluripotential hematopoietic stem cell remain as pluripotential hematopoietic stem cell. They give rise to themselves only so as to replenish their supply, so as to provide more of themselves. Okay, then but this is a very small proportion that does that. Now most of it, what it does is that it forms different committed stem cells. Committed stem cells are basically those stem cells which get committed to a specific line of sequence, a specific line of events that gives the specific line of events that gives rise to a specific blood component. So for example, now the pluripotential hematopoietic stem cell, if we go horizontally, it will give rise to colony forming unit spleen. And now this colony forming unit spleen further differentiates into three different types. Okay, it forms the colony forming unit blast, colony forming unit granulocyte monocyte, and colony forming unit megakaryocyte. We are going to talk about them one by one. Okay, colony forming unit blast gives rise to colony forming unit erythrocytes. These are basically the cells which are formed before erythrocyte production, and then they finally mature into erythrocyte production. They mature into erythrocytes. We've talked about erythrocytes in great details in the previous lectures. Do check that out before continuing with this lecture. Okay, so now, and this scheme over here in this branch, we are gonna look at it in detail in a bit as well. All right, so the maturation of blood cells, maturation of red blood cells is what we are gonna do immediately after this. Okay, now the colony forming unit spleen also gives rise to colony forming unit granulocytes and monocytes. We've covered granulocytes and monocytes in the previous lectures as well. Okay, granulocytes are those which contain granules. The examples include neutrophils, eosinophils, and basophils. They contain secretory granules that take up the stain. And monocytes. Monocytes are basically the preformed macrophages, the cells that give rise to macrophages in the tissues. Okay, monocytes are present in the blood. So both of them, and all these are have phagocytic activity. These are white blood cells. They are formed from colony forming unit, granulocyte monocytes. Okay, and then the third one, which is formed from the colony forming unit spleen, is called the colony forming unit megakaryocyte. Megakaryocytes, they give rise to megakaryocytes, which are basically the cells that break down to form platelets. As I told you in the previous lectures, that platelets are not true cells. They are actually pieces of larger cells. These are the larger cells that break down to form the platelets, the megakaryocytes. Now let's look at the vertical branches. Okay, a small proportion give rise to themselves. Then some of them give rise to lymphoid stem cells. Okay, lymphoid stem cells are basically those stem cells that give rise to lymphocytes. And the two types which I have labeled over here are the B and the T lymphocytes. Okay, both of them are white blood cells. Again, A granulocytes, we've talked about them as well in the previous lectures. We are going to talk about them in great detail when in the upcoming lectures while we'll be doing immunity. Okay, so this was pretty much it for the scheme. Now some important information over here. The growth and reproduction of different types of stem cells is controlled by growth inducer proteins. Okay, the growth inducer proteins, they almost all the different types of stem cells, their growth and reproduction is controlled by growth inducer proteins, not differentiation. Okay, guys, this is important. It's not differentiation. Differentiation is controlled by differentiation factors, differentiation inducers. Okay, but the growth inducers, they only control the growth and reproduction. An example is interleukin 3. Interleukin 3 is an example of growth inducer, whereas differentiation inducers, they differentiate a certain committed stem cell and cause it to form its final differentiated form. Okay, the differentiation inducers. Both the growth and differentiation inducers, their concentration is controlled by external factors. For example, when hypoxia occurs, when oxygen concentration in the tissues decreases, the red blood cell count increases. The red blood cell count, meaning the erythrocyte count, has increased. If we look at this diagram, the erythrocyte count will increase only if this colony forming unit blast increases, only if all this scheme increases. So basically, the growth and the reproduction and the differentiation of the stem cells, when if it increases, so the erythrocyte production will increase. So it's actually that an external factor that controls the growth in the concentration of growth and reproduction factors, the growth factors, and the differentiation inducers. So it's external factor like the example given over here, hypoxia. Whereas in case for white blood cells, certain infectious diseases cause the number of white blood cells to increase. And so again, there will be an increase in the growth and differentiation factors in this case as well. Okay, so again, both of them are external factors. In one case, it's the hypoxia in case of red blood cells, and the infectious diseases in case of the white blood cells. Now let's come to the main discussion: the maturation of red blood cells. How are the red blood cells capable, the different steps that are involved in its for maturation and its formation. Okay, basically the very first cell of the erythrocyte series is called the proerythroblast. Okay, this is the first cell that belongs to the red blood cell series. Okay, now it differentiates into basophil erythroblast. These are called basophil erythroblasts because they stain with basic dyes. Okay, basophil means base loving, so they can take up basic dyes. Then they give rise to polychromatophil erythroblasts, then orthochromatic erythroblasts, and then finally reticulocyte. It's the reticulocyte stage when the red blood cell they diffuse into the uh, blood capillaries through a special process called diapedesis. Diapedesis is actually the squeezing from the bone marrow into the capillaries, the squeezing of these cells from the bone marrow cells into the blood capillaries, and then it stays in the reticulocyte stage for 1 to 2 days in the blood, and after 1 to 2 days uh, they give rise to mature erythrocytes. Okay, now let's look at them one by one. First cell belonging to this is the proerythroblast, which contains very little hemoglobin. But as we go down this series, the hemoglobin concentration is increased. More and more hemoglobin is accumulated going down this series. Approximately a maximum of 34% hemoglobin gets accumulated while we reach the erythrocytes stage. Okay, so this is the maximum concentration of hemoglobin that a red blood cell can contain, a mature red blood cell can contain. Okay, now then the nuclear material condenses as we go down. The nuclear material, the different organelles, they all diminish. They condense, they are destroyed basically, or they are resorbed inside the cell, or they are excluded out of the cell. Is basically the reticulocyte stage when the nucleus is extruded from the cell. Okay, the nucleus, this cell over here, it loses its nucleus. Initially it had a nucleus, but then after reaching the reticulocyte stage, the nucleus has been lost and only small remnants of organelles are present. For example, the small remnants of mitochondria, small remnants of Golgi body, etc. are present. But if the erythrocytes at the erythrocyte stage, none of the organelles are present. Basically, very little organelles are present, so as to provide more room for this hemoglobin. And the mitochondria nuclei are absent from mature erythrocytes. 1 to 2 days, basophilic appearance disappear to form the mature erythrocytes. Okay, the basophilic appearance was due to the small remnants of the organelles which are left in the reticulocyte stage. Okay, so these were the different schemes of events. Okay, now I've also drawn a diagram over here. Let's look at it. Okay, now over here, okay, this is not for us. All right, over here, colony forming unit erythrocyte, erythroid, or colony forming unit erythroblast, erythrocyte, basically. I've started from here, CFUE. Basically, if you look at the diagram that we just did up there, this diagram, we have colony forming unit erythroid or colony forming unit erythrocyte that gives rise to the erythrocytes. Now we are going to look at the detailed events that occur in between these two stages. Okay, we've done that basically, but I've put them together in a diagrammatic fashion. Okay, colony forming unit erythroid or colony forming unit erythrocyte, they give rise to proerythroblast. Okay, we talked about proerythroblast over here. Okay, proerythroblasts, I told you, are the first cells of red blood cell series, the first cells of the RBC series, the erythrocyte series, the proerythroblasts, which are formed from the stem cells. These are also blast cells. Okay, now these proerythroblasts will form basophil erythroblasts, and then polychromatophil erythroblasts, and orthochromatic erythroblasts, then reticulocyte stage. This is the stage when the nucleus is extruded from the cell, and then um, these reticulocytes through diaperesis enter the blood capillaries. Diaperesis is the squeezing of these cells into the blood capillaries. Then in the blood capillaries, they stay in the reticulocyte stage for 1 to 2 days, and then finally mature into mature erythrocytes. So this was pretty much it for maturation of erythrocytes and of different bone marrow components giving rise to different cells. In the next lecture, we are going to do the factors that affect this maturation of erythrocytes. I've given the link to that in the description, so please do check it out.